Hi, my name is Soptik Debnath, and I'm currently a senior high school student from Bangladesh. And today I'm going to present you all planetary health and mental well-being in South Asia, and also going to show a model that could possibly help us in eradicating mental health issues in South Asia. So let's talk about myself. And I'm organizing secretary of Nirboy, a non-profit organization to bring justice and social impact in Bangladesh, and also a national champion in traditional Jari song, and also performed in national television and also in state performed. And also I accomplished lots of arts hours from nationals to internationals. I love to play football and I love to draw and I love to sing. So what is mental health? Mental health is the foundation of our emotional, psychological, and social well being, helping us cope with life's changes, building meaningful relationships, and contribute to our communities. It affects how we think, feel, and act, and is essential at every stage of life from childhood to adulthood. Then comes what's the current situation and vulnerability in South Asia? One, rising prevalence of mental disorders. Depression, anxiety, and self-harm are increasing across South Asia. A recent review found that 16% of adults experience depression and 12% suffer from anxiety. Yet many cases go undiagnosed. Two, deep-rooted stigma and cultural silence, mental health is often seen as a taboo or superstitious belief in South Asian cultures. People fear being judged or shamed, so they avoid seeking help even when they are suffering deeply. 3. Limited access to care and trained professionals. Most South Asian countries face a severe shortage of mental health professionals and facilities. In rural areas, access is nearly non-existent, and even in cities, services are often unaffordable or poorly resourced. 4. High societal pressure and economic stress. Intense expectation around academic success, family honor, and financial survival contribute to rising stress, especially among youth. These pressures often lead to anxiety, burnout, and depression. And 5, lack of national mental health policies and data. Only a few countries like India, Pakistan, or Nepal have the national mental health policies, and many lack reliable on mental illness prevalence. This makes planning and funding more difficult. So why South Asia is especially vulnerable? 1. High population density strains healthcare systems and increases exposure to stress and poverty. 2. Cultural stigma prevents often conversations and early intervention. 3. Rapid urbanization and economic inequality create environments of chronic stress. 4. Climate change and conflict like floods, displacement, political instability, worsen trauma and mental distress. And the last is youth bloods. With a large young population, untreated mental health issues risks becoming a generational crisis. So let me introduce my model Asha as known as hope. It has three pillars: one, connection; two, intelligence; and three, healing. So it finds problems from our society and gives a solution. So first, we're going to talk about breaking the silence, Asha's anonymous connection. In South Asia, mental health stigma silence millions. People fear being labeled mad or sick. So they hide their pain behind metaphors like "my heart is sinking" or "their shadow is my mind." There's a shadow in my mind. This cultural shame prevents early intervention, leaving distress to fester in isolation. What's the solution it can give? Asha introduced an anonymous cure-based lifeline by placing QR codes in everyday spaces like rickshaws, school gates, or tea stalls. Individuals can scan and connect without revealing their identity. The system routes them to trained listeners who understand local dialects and metaphors. No app, no login, just a voice, a safe space, and the beginning of healing. This process respects cultural sensitivities while opening a discreet door to care. Then, second, Asha's voice intelligence. So, mental health in South Asia is rarely expressed in clinical terms. Instead, people use poetic metaphors rooted in culture, like chest is heavy, my soul is tired. These expressions often go are misunderstood by traditional systems, leading to misdiagnosed or neglect. Some of the AI can't even understood this type of term. So what's the solution it can give? Asha's voice intelligence listens for regional dialects and metaphorical language. When someone calls the system detects emotional cues and routes them to culturally trained responders. This ensures that pain is not just heard, is understood in its cultural context, allowing for accurate and empathetic support. Then comes digital harm. So social media platforms like Instagram or TikTok have amplified anxiety and self-harm among South Asian youth. Online spaces often reinforce unrealistic standards and cyberbullying, while mental health apps remain inaccessible or stigmatized. So, what's the solution can provide? That is, Asha bypass digital overload by offering offline access. What is offer? What is the offering offline access? That is, user can reach support through missed calls or QR scans, no downloads, no data plans. This low-tech approach protects vulnerables from digital harm while making mental health care radically protected. And then comes climate trauma. Cyclones, floods, and displacement have left deep psychological scars across South Asia. Children and families suffer from PTSD, anxiety, and grief. But mental health services rarely reach disaster zones or recognize climate-linked trauma. What's the solution it can provide? It detects trauma clusters through call patterns and initiates community healing circles. These are locally led support groups that offer collective care, storytelling, and resilience building. By rooting healing in community, Asha transforms climate trauma into a shared strength. Then comes generational pain. So, in South Asia, elderly often feel abandoned, while youth face overwhelming pressure. The emotional gap between generations leads to isolation, misunderstanding, and missed opportunities for healing across age groups. Worse, it can provide, that is, it trains elders as heartline listeners, trusted community figure who offer empathy and wisdom. Youth connect anonymously and elders respond with culturally grounded support. This bridges generations, revives oral traditions, and restores emotional connection. So, in my conclusion, I want to say that mental health in South Asia is shaped by silence, stigma, and cultural complexity. Asha offers a community rooted, metaphor driven model that listens, connects, and heals without asking people to change who they are. By honoring local languages, stories, and relationships, Asha transforms mental health from a private burden into a shared movement. Let's adopt villages, train listeners, and turn metaphors into lifelines. Because healing begins not with silence but with heartlines. Here's the reference, and thank you for listening to me.